So I went into public health because I wanted to use science to help policymakers figure out what they needed to know to make the best decisions possible. Public health is a complex, dynamic, interwoven series of fields. At its core, it's fundamentally groups of people who are trying to work together to improve the health and outcomes of the people around us.
Public health is everything. You know, public health, it's the air you breathe, it's the water you drink, it's the food you eat, it's having connections with people.
Public health to me means being able to provide resources to the community, being able to hear that feedback from community members on what resources currently aren't available and how we all can work together to improve the health.
Well, with the public health program, you're learning about community relations, how disease spreads in the community, and how that's responded to.
Public health is important everywhere, but I think it has a particularly strong role when it comes to rural healthcare and rural healthcare delivery.
I grew up in a very rural part of Wisconsin. There was limited resources, and so I knew that I wanted to focus on community level health.
We know that rural populations have higher rates of most diseases. Their medical care is challenging, and for whatever reason their outcomes are worse than in other patient population groups. So for us, being able to leverage the power of public health is going to be a really important strategy to try to get the best outcomes we can for the people of rural Wisconsin.
I feel like the master's level program really helped provide a foundation and allowed for that practical experience. Everything that I had learned from my coursework, I'm still able to apply to today's work.
It definitely gave me additional learning opportunities. I know we did a lot of case studies.
If we can get more individuals working in this space, we will truly see a healthier community.
You know, if I've learned anything about healthcare in our region, it's that we really are an interconnected network of care systems, individuals, working to try to bring the best care we can to our patients.
This community-minded approach is collaborative. And so if we're caring for people, we need to understand and allow them to also have a strong hold or strong say in the decision making for their care.
It should always be a collaborative field. You should never do something without the input of the community or without, you know, them guiding you. They know their health best, they know what they need, and so we should be helping them get there.
I think a degree in public health equips you to understand the broader implications of whatever it is you're doing in the rest of your life.
You know, I just think it's cool to be doing something for the community in a collaborative way.